Should I get genetic screening for CF carrier status? Deciding whether to get genetic screening for cystic fibrosis carrier status can feel overwhelming, but understanding the facts can help you make an informed choice. Cystic fibrosis is a genetic condition caused by mutations in the CFTR gene, which affects how salt and water move in and out of cells. It mainly impacts the lungs and digestive system. The condition is inherited in an autosomal recessive pattern, meaning a person needs two copies of the mutated gene to have cystic fibrosis. If you have only one mutated copy, you are a carrier and usually do not show symptoms. Carriers can pass the gene to their children, which is important to know if you're planning a family. Genetic screening for CF carrier status involves a simple blood test or a cheek swab to analyze your DNA for common mutations in the CFTR gene. While these tests are highly accurate, they may not detect all rare mutations. If you find you're a carrier, it's recommended that your partner also undergoes screening. If both partners are carriers, there is a 1 in 4 chance with each pregnancy that the child will inherit cystic fibrosis. This information can help you plan ahead and consider options like prenatal testing or reproductive choices. Getting screened can be especially helpful if you have a family history of cystic fibrosis or belong to an ethnic group with a higher prevalence of CF carriers. For example, CF is more common among people of Northern European descent, but it can affect individuals from all backgrounds. Knowing your carrier status does not impact your health directly, but it provides valuable insight into your reproductive risks. It's important to remember that being a carrier does not mean you will develop cystic fibrosis. It simply means you have a higher chance of passing the gene to your children if your partner is also a carrier. If you are identified as a carrier, talking with a healthcare provider or genetic counselor can help you understand your options and what steps to take next. They can guide you through additional testing or reproductive planning if needed. In the end, whether to get tested is a personal decision that depends on your family history, ethnicity, and reproductive goals. It's always best to discuss your specific situation with a healthcare professional who can provide personalized advice based on current medical guidelines. Remember, being informed is the first step toward making choices that align with your values and future plans.